share my screen. And today we're going to start and finish chapter 8. Let me share the right one. And yep, these are somatic symptom and dissociative disorders. All right, so first, we're going to identify what soma. So soma means body, right? Okay, so somatic symptom disorders, these involve physical symptoms and complaints, but they contain no evidence of physical cause. Has anyone heard of like fibromyalgia, where these people complain of pain, like like on their skin, like it burns and it hurts, but they can't find any neurological cause. All right, and then we're going to talk about at the end of the chapter dissociative disorders, which involve physical symptoms and complaints, but it's kind of a feeling of being out of it, right? So let's start with somatic or somatoform disorders, right? Soma means body. The bodily symptoms cause significant psychological distress and impairment, and these may be medically explained or unexplained. Sometimes they can't trace them, okay? And the patients are shown to have no control over their symptoms. So the most important disorders, right? We have the somatic symptom disorder, the illness anxiety disorder, a conversion disorder, and then the factitious, which I think is the most interesting one of all of them. Okay, so let's start with the somatic symptom disorder. Right. So to diagnose, the patients have a chronic distressing somatic symptoms like physical pain, dysfunctional thoughts, feelings, or behaviors, high levels of anxiety about their health or the symptoms, and you only need one symptom for this to be present. So, what could be the cause of these somatic symptoms? Okay, it could be your experiences with illness. It could be that you have a negative affect, meaning you're in a, you think negatively. Absorption, which we're going to talk about in a second, and alexithymia. We're going to talk about in a second. Oh, okay, I guess not. So absorption is where it is like all absorbing, as in like it bothers every aspect of your life. You know when you have seasons of like flies and ladybugs? We have like fly season, ladybug season, that kind of thing. Um,
Yeah.
Fly season's over, and I have this one fly in my house, and it's driving me. And it's always the one that's like super hyperactive too. It really upsets me. Let's see. I know that they describe
What's the
alexithymia.
Xemia?
The what? That one?
The Xemia? I don't know
Yeah.
how to say it.
Hold on. Whoop. Across. Where are we? Come on.
I had a salad last night for dinner, and the entire time I was eating my salad, I was thinking of the word salad dog.
Ha! Even when I heard you say you had a salad, I thought salad dog. That's funny. Oh, so alexithymia is or alexithymia, sorry, alexithymia. Oh, I can get it. Is something I think I might even have, and that's where they have difficulty describing the symptoms or the feelings or the problems. Like I know when
Yeah.
I go to the doctor and I got a problem, they're like, "Well, what hurts?" I'll be like, "Here." And they're like, "Well, what's wrong with it?" I'm like, "Here." And they say, "What does it feel like?" Hurt. Like I cannot describe like is
I'm the
it
same
deep
way.
or is it topical? Yeah. All right, skip this. All right. So how do we treat somatic symptom disorder? Cognitive behavioral treatment, um, relaxation training, validating the person that it's real, even though they can't really pick up on it physically. Um, Having them practice healthy daily activities, and then cognitive restructuring, where they emphasize doing more of the things that don't cause pain. There's also medical management, with the seeing the patient on a regular basis with a focus on new complaints, right? So what they're saying is they say, okay, what other things do we have? Just let's talk about that right now. Let's do the other thing. I know your arm hurts. It's been hurting for months now, but what is this other thing you got a problem? Ignoring the other one, which then lessens the experience. Because the whole idea behind this essentially is it's your mind focusing. It's focusing on the problem, and when we focus on it, when we're looking for it, it exacerbates the problem. So there are minimal diagnostic tests and medications to treat this. Illness anxiety disorder, right? High anxiety about having or developing a serious illness. And this occurs for at least 6 months. There's no somatic symptoms, or if there are, they're mild, if any. Um, and then lastly, the performance of excessive health related behaviors. Um, so think of like constantly washing your hands, constantly brushing your teeth, constantly taking a shower, constantly cleaning the tables, that kind of thing. So onto conversion disorders. These are functional neurological symptom. It's a functional neurological symptom disorder. So the neurological symptoms are in the absence of a neurological diagnosis. Okay. So the symptoms or the deficits affecting sensory or voluntary motor functions. So what you see with these people is that they have this would be the fibromyalgia. Okay. So you have the symptoms, but there's no way to detect it. Right? They feel pain, but when they look at the nerves, there's no nerve activity. There's no nervous system activity. So there's a range of conversion disorder symptoms. Um, the sensory symptoms or deficits. These are typically related to visual and auditory systems. So they could hear or see things, or they don't hear and see things well. Um, they have motor symptoms or deficits. And again, these are a wide range that include things like seizures, right? So muscle rigidity, muscle spasms. Now, these resemble epileptic seizures, but they're not true seizures. And the reason why is we can detect seizures in the brain for people diagnosed with epilepsy, right? We can actually pick up on neural firing. We can't in the conversion disorder symptoms. Um, I didn't really care about. Okay, so I was saying, but for an accurate diagnosis, the dysfunction does not conform to symptoms of a particular disease or disorder simulated. I don't even know what that means, and I don't even care that it's highly selective. Here's the thing that I found that I want you to know that's interesting is that the symptoms that they experience can be removed under hypnosis or narcosis, which is medical sedation. They don't feel the pain under hypnosis. And so, what is hypnosis all about? A heightened state of suggestibility. It's a distraction. You're saying now, someone's under hypnosis. Now you're thinking about, you know, your salad dog or whatever, right? Or your car, whatever. And as a result of that, they're not experiencing the symptoms anymore. Um, okay, so some possible causes of conversion disorders. They say the primary gain, meaning the primary, we'll say motivation, is attention. And then the second one could be monetary, money. So how do you treat it? With behavioral therapy? We go on to this? No. Okay. With behavioral therapy, the idea is to, again, focus on behaviors that don't cause pain. Cognitive behavioral therapy, restructuring the thoughts that kind of don't focus on the areas that are bothering you, but focus on other areas that either could be bothering you or that are not. And then lastly, hypnosis and the narcosis. Now, you've heard of this before, a factitious disorder. It says the person intentionally produces psychological or physical symptoms or both. The goal is to obtain and maintain benefits of playing the sick role. Factitious disorders can also be imposed onto another. How many of you heard of Munchausen's by proxy?
No.
No? Tears, have you heard of it? Munchausen's? You ever?
I don't.
No? Timmons?
No, I don't think so.
Never even heard of it? The word? Munchausen's?
Sounds like a scientist or something.
Yeah, I think it was someone. I think that's the name of the person who coined it. Okay, so here's what it is. Munchausen's by proxy is where, and I know you've heard of this. I know you have, because you watch murder shows like I do, and like Snapped and Forensic Files and stuff like that. You ever hear those stories about women who intentionally make their children sick?
Mm, yeah.
Yeah, right. That's Munchausen's by proxy.
Ugh.
Yeah.
So it's like a disease when you like. So the people like the moms that like go like make their kids sick, like they have that.
Yes,
Like
the moms
that,
have it.
like that show. I didn't watch it. It's on Hulu about that, and I think it's. I don't know if it's based on a true story, where that girl, where that mom like makes her daughter think she has cancer or something, and literally like
Oh
injects her with stuff
yeah.
to make her sick.
Yep.
And she like killed her mom or whatever, right? Didn't she end up killing her mom, her and her boyfriend?
I don't know. I didn't watch it. I just remember hearing about it.
There, I do know of several. I know I've heard of several stories where the daughter and the boyfriend killed the parents or the mom or whatever. I don't recall it being related to this factitious disorder. Um, but isn't that interesting? I don't know. It's interesting to me. All right. So distinguishing between different types of somatic symptoms and related disorders. It's sometimes possible to distinguish between a conversion or other somatic symptoms disorders and malingering or factitiously sick role playing. In other cases, it's more difficult to make the correct diagnosis. So, what does this mean? It means ultimately, sometimes it can be difficult to determine whether or not it's a true somatoform disorder or if they're doing it intentionally, knowingly, looking for attention. Dissociative disorders. You've heard of dissociative identity disorder,
Hmm.
right? So that means it's also known as multiple personality disorder. Um, so it's being out of touch with reality, essentially, right? It's disruptions in normally integrated functions like consciousness, memory, identity, perceptions, movements. So what can happen is that it can actually affect our implicit memory in the sense that um, you see a higher incidence of people with dissociative disorders where they can say, I know this happened. I just don't know where it came from, right? And even with their perceptions, like they'll respond to things, but they don't. But it says they can't report having seen or heard them. They'll go, and then what did you see? And they'll be like, nothing, right? So it impacts their both their implicit memory and their implicit perception. Let's see. Now, other dissociative disorders, depersonalization, derealization, dissociative amnesia, and dissociative identity disorder. So derealization is that you're basically out of touch with the outside world. That the what's real isn't real to you anymore. Depersonalization is where you've just lost your uh, sense of self. Really, dissociative amnesia. Um, it's a limited or a failure to recall previously stored personal information. The failure cannot be accounted for by ordinary forgetting, and it often follows high stress. Dissociative fugue, which is fugue is a fugue state is where we say you're just confused essentially. I think it was like confusion. So a dissociative fugue is dealing with your identity. So it's identity loss, and then the assuming a new identity. So dissociative identity disorder is the disruption of identity characterized by, and here we have multiple. That's the problem with this one. right? So there's more personalities coming out, essentially. The dissociative fugue is where you have loss of yours and adopting a new one. This one's you got multiple, right? And it's shown with recurrent episodes of amnesia, memory loss, and this could be either self-reported, like people could say, "Look, I have multiple personalities," or other people can go, "Yeah, I don't know about Chloe. I don't know. She keeps saying that she's Maureen or somebody who's always trying to bum a cigarette. She doesn't even smoke. It's weird. I'm gonna call you Maureen." There was this woman when I lived in Batavia, when my wife and I lived in Batavia, New York, with our oldest two, and that we had an apartment. We shared this building. You know those buildings where you have like multiple apartments in them. So the woman next to us was an older woman who was just out of touch, we'll say. But she'd always walk around and say, "Can I bum a cigarette?" I'll never forget that. Okay, so some controversies regarding dissociative identity disorder. Is it real or is it faked? Right? If the disorder is faked, how does it develop? Are recovered memories of abuse in the disorder real or faked? Because that's right. That's where some of these big things come out. They go, I was abused as a child, and then these people are accused and they're you know uh, uh, um, punished. Are they real? So if abuse did occur, did it play a causal role? A lot of people think that dissociative identity disorder comes from the role of the therapist by rewarding, right, the person. That's good. Do you have another personality? Good. Let's hear another one. So, the reported childhood abuse in 4 separate studies of patients with dissociative identity disorder, and this included a total number of 488 people. So, what they found is in all these different studies, 4 separate studies, um, that when it came to sexual abuse, there was a high percentage of them that reported having been sexually abused as children. Physically abused also high. So you would think, again, from the surface, you think, okay, is this causal? Or is the memory of being abused the effect? Does that make sense? Did I make sense?
Yeah.
Like, is the memory good? Like, is the memory a symptom? Like, is the false memory a symptom? Is it false? Because it's way up there. No, you wouldn't have this. This is not normal. So the current perspectives are that patients with dissociative identity disorder, as compared to simulators, show more symptoms of dissociative identity disorder. I wanted to say did than simulators do. Uh, I don't know what does simulators mean. Oh, it must be fakers. Okay, so they show more cognitive processing problems, and they show similar memory transfers. So some cultural factors. The prevalence is influenced by the degree to which the phenomena are accepted or tolerated. So they're saying that there's a cultural influence about the number of reported cases uh, um, at any given point in time. So we'll just say like a yearly prevalence. Um, if the culture is more lax about it, if they're more accepting of it, they're saying there's going to be more cases. Pathological possession. Um, some cultures believe in, let's see, in some Latin American cultures, they have attack de nervios, right? Where it's considered somewhat normal, where people just start crying and screaming and thrashing about. Um, and then cross cultural variance. So amok is a kind of, uh, you could call it a behavioral or a anxiety disorder because it's very specific. The symptoms are very specific and unique to this one culture, and I cannot remember what the culture is. Amok. 1 second. feel like this might be. Would dissociative episodes lead to violent, aggressive, or homicidal behavior? Yeah, I don't know where it is though. Where? Where? According to Malaysian Indonesian, it's a Malaysian Indonesian word. Where? Here we go. Malaysia, Puerto Rico, and the Philippines. It's most prevalent. There it is. Malaysia, Puerto Rico, and the Philippines. Malaysia. Okay. So how do we treat it? Hypnosis, drugs, and then integration of the separate identities, essentially combining them all into one somehow. All right. So we already kind of discussed how recovered memories, right? So what happened uh, as children? So we call these retrospective accounts, right? So how could they be linked? Is it causal or is it the effect, essentially? Recovered memories of childhood abuse are thought by some to be causal, others to be falsely planted by therapists. It's a very controversial topic that presents various legal and ethical challenges, right? So, at what point do you say, okay, this is enough for us to believe that this is true, or this is enough for us to believe that this is so common that it may not be true? And what do we do with that?